Hey everyone, and welcome back to the podcast Learn Spanish Like I Did. I'm Wesley, and I've got Emilio with me today. We're diving into a topic that's super practical, but often overlooked until you really need it, talking about your health in Spanish.
That's right, Wesley. It's one of those things you don't think about until you're in a bind. And let me tell you, I've been in that bind. I had an experience a few years ago that really drove home just how important even basic health vocabulary is when you're in a Spanish-speaking country.
Oh, do tell. We always love a good story here. What happened? Were you on vacation or living somewhere?
I was actually on a trip to Mexico, exploring Oaxaca, which is just a beautiful, vibrant city. Everything was going great. I was practicing my Spanish, feeling pretty confident. But then, one morning, I woke up with this absolutely blinding headache. I mean, not just a little, oh, I need coffee headache. This was a full-blown, pounding, can't even look at the sun kind of head pain.
Oh no, that's the worst, especially when you're trying to enjoy a trip. So what did you do? Did you immediately think, I need a doctor? Or did you try the pharmacy first?
I figured a pharmacy was the quickest route. I wasn't feeling like it was an emergency, but I definitely needed some relief. So I stumbled out of my Airbnb, holding my head, and managed to find a farmacia not too far away. The problem was, when I got inside, my mind just went blank. All those Spanish lessons, all that vocabulary, it just vanished in a fog of pain.
I can totally relate to that. When you're under pressure or not feeling well, your brain just doesn't connect the dots the way it usually does. So how did you manage to communicate what was wrong?
Well, thankfully, I remembered one crucial word. I walked up to the pharmacist, who was a really kind woman, and I just pointed to my head and said, tengo dolor. And then, realizing that wasn't quite specific enough, I remembered cabeza. So, tengo dolor de cabeza. She immediately understood, thankfully. She nodded, went to a shelf, and brought me exactly what I needed. It was such a relief.
Wow, that's a perfect example of how just a few keywords can make all the difference. So dolor for pain and cabeza for head. That's super foundational. And tengo dolor de cabeza, meaning I have a headache, is exactly what we want to focus on today, that tener symptom structure.
Absolutely. It was a light bulb moment for me. Like, this isn't just about passing a test, it's about real-world survival and comfort. After that, I made it a point to learn more. She gave me some medicina, and I was back to enjoying Oaxaca within a couple of hours. But it could have been a much longer, more frustrating experience without those basic phrases.
Exactly. So let's break that down a bit for our listeners. We have dolor, which means pain. It's a masculine noun, so el dolor. And cabeza, which is head, a feminine noun, la cabeza. When you combine them, you get dolor de cabeza, head pain or headache.
And the key verb there is tener, which means to have. So tengo dolor de cabeza literally translates to I have pain of head. It's a very common construction for expressing symptoms.
Right, so it's not soy enfermo or estoy enfermo for I am sick, though you could say estoy enfermo. But when you're talking about specific symptoms, you use tener. Tengo fiebre for I have a fever. Tengo tos for I have a cough. It's incredibly versatile.
It really is. Once you grasp that tener symptom structure, a whole world of self-diagnosis, or at least self-description, opens up to you in Spanish. It's so empowering.
Let's list a few more common symptoms then. So we've got dolor de cabeza for headache. What about other types of pain, like if your stomach hurts?
Ah, that's a good one. For stomach pain, you'd say dolor de estómago. Estómago is stomach. And if it's a general body ache, maybe you'd say dolor de cuerpo. Cuerpo means body. You can just swap out the body part.
That's super helpful. So if I have knee pain, dolor de rodilla. If my back hurts, dolor de espalda. It's quite intuitive once you know the core words. What about a sore throat?
For a sore throat, it's dolor de garganta. Garganta is throat. So tengo dolor de garganta. See, it just slots right in. And sometimes you might hear people say me duele la garganta, which means my throat hurts me, using a different verb structure, but tengo dolor de garganta is perfectly fine and often easier for beginners.
That's a great point about the alternatives, but sticking to tener definitely simplifies things when you're just starting out and under stress. So we've got pain covered. What about other common cold or flu symptoms? You mentioned fiebre earlier.
Yes, fiebre is fever, so tengo fiebre means I have a fever. Then there's tener symptom structure for cough, so tengo tos. For a runny nose, you can say tengo secreción nasal, or more commonly, tengo moqueo. though secreción nasal is more formal. Or you might hear tengo la nariz congestionada for a stuffy nose.
Okay, fiebre, tos. What about if you just feel generally unwell, like you're coming down with something?
You could say me siento mal, which is I feel bad. Or if you suspect it's a cold, tengo un resfriado. Resfriado means cold. If it's the flu, you'd say tengo gripe. Gripe is flu. These are super common and super useful.
So, just to recap some of those tenor phrases, tengo dolor de cabeza, headache, tengo dolor de estómago, stomachache, tengo dolor de garganta, sore throat, tengo fiebre, fever, tengo tos, cough, tengo un resfriado, a cold, tengo gripe, flu. That's a powerful toolkit right there.
It really is, and often that's enough for a pharmacist or even a doctor to get a good idea of what's going on, especially if they speak some English but you're trying to meet them halfway. It shows effort and people appreciate that.
Let's talk about medicina a bit more. When you got your headache medicine, did you just ask for medicina para el dolor de cabeza, or was there a specific name?
I actually just said necesito medicina para el dolor de cabeza, which means I need medicine for the headache. And she knew exactly what I meant. She offered me a few options, and I just picked one that looked familiar, an ibuprofen equivalent. It was straightforward.
That's great. So medicina is generally applicable. And necesito is another great verb to know. I need necesito medicina. Short and to the point.
Exactly. And if you're talking about a prescription, you might hear receta, as in tengo una receta, for I have a prescription. Though in many Latin American countries, you can get a lot of medications over the counter that might require a prescription in, say, the US.
That's a super important cultural difference to note. So if someone is traveling, they shouldn't assume they'll need to see a doctor for everything. A pharmacy can often be the first port of call. What about when you're asked how you're feeling? What's a simple way to respond if you're not well?
Great question. Someone might ask, ¿Cómo te sientes?, which is, how do you feel? A simple answer if you're unwell is, no me siento bien, I don't feel well. Or you can just state your symptom, tengo dolor de cabeza. Or estoy un poco mal. That un poco means a little bit, which can soften the blow.
I think it's also good to know a few basic questions you might be asked. For example, ¿Dónde le duele?, which means where does it hurt? So being able to point or say the body part is key.
Yeah, absolutely. And if you have allergies, that's another critical one. Tengo alergias a, or soy alérgico a, for I am allergic to, and then name the substance, like penicillina for penicillin. That could be life-saving.
That's a fantastic addition. So tengo alergias a, for I have allergies, and then you can specify. This conversation just really underlines how practical Spanish learning can be. It's not just for ordering food or asking for directions, it's for those critical moments when you might be vulnerable.
Exactly. My experience in Oaxaca really hit that home. I mean, I love learning about grammar and verb conjugations, but knowing how to say tengo dolor de cabeza when your head is throbbing is infinitely more valuable in that moment than knowing the subjunctive mood for hypothetical situations.
Truth. It really grounds your learning. And you know, a lot of people find that once they have these basic, practical phrases down, it gives them the confidence to tackle more complex grammar, because they see the immediate benefits.
Totally. It's like, okay, I can actually do something with this language. It's not just an academic exercise. I can communicate a real need and get real help. That's a huge motivator, and honestly, it makes you appreciate the kindness of strangers even more when they're helping you through a language barrier when you're not feeling well.
Definitely. So for our listeners, what would be your top piece of advice for practicing these phrases? Beyond just listening to us, of course.
I'd say start with the absolute basics. Think about what you'd say if someone asked you right now how you feel. Do you have a headache? A slight cold? Try to say tengo dolor de cabeza or tengo un poco de tos out loud. Then, imagine you're at a pharmacy. What would you ask for? Necesito medicina para la fiebre. Practice these simple scenarios. Repetition helps so much.
That's a great approach. Role-playing in your head, or even with a friend, can really cement those phrases. And don't be afraid to make mistakes. The goal is to be understood, not to be perfect.
Exactly. Most people, especially healthcare professionals, are incredibly patient when they realize you're making an effort. They just want to help you, and knowing these basic phrases shows you're serious about communicating.
Another thing is to keep a little note on your phone or a small card with these phrases. If you're really feeling unwell, you might not remember everything, and having a quick cheat sheet can be a lifesaver. You can point to it if you need to.
That's a brilliant idea, Wesley. Preparation is key. And also, don't forget to learn the names of any medications you take regularly, just in case you need to communicate that to a doctor or pharmacist. They might not have the exact brand name, but they'll often have the generic equivalent.
Absolutely. Knowing the active ingredient is even better. So for anyone out there planning a trip or just wanting to be better prepared, definitely take a few minutes to learn these essential health phrases. It's a small investment with a potentially huge payoff.
Couldn't agree more. It turns a potentially terrifying situation into a manageable one. My headache in Oaxaca taught me a valuable lesson, and I'm glad we could share some of those key takeaways with everyone today.
It was a fantastic story, Emilio, and really brought these practical phrases to life. So remember our core vocabulary, dolor, cabeza, medicina, and our key grammar structure, tener symptoms, like tengo fiebre or tengo dolor de estómago. You've got this.
Yep, keep practicing. Thanks for joining us, everyone. Stay healthy and keep learning Spanish.
That's all for this episode. We'll catch you next time for more practical Spanish tips on Learn Spanish Like I Did. Adios.